what I have been taking up in pharmacology. So the previous video of mine was on glucocorticoids, the side effects of glucocorticoids. So in succession to that video, in pharmacology, you are supposed to, you mostly get such, if related to corticosteroids, there is a question whether it can be asked in the professional exams or in the viva voce. The examiner can ask you that why do we taper the steroids, or why sudden or abrupt withdrawal of corticosteroids should be avoided. So students and viewers, beginning with, so this is being a very important question. Either the question can be framed in the form that explain why glucocorticoids therapy should not be stopped abruptly, or the question can be framed in the form that abrupt cessation of prolonged administration of glucocorticoids is hazardous. Explain. So when answering this question, this is very important. In pharmacology, it can be asked from you. So students and viewers, beginning with, why do we taper the steroids, and why glucocorticoids therapy, if it is administered for a longer period of time, why it should be stopped, by tapering the dose. It shouldn't be stopped abruptly. So the basic reasons are, basically, one thing you should very honestly remember, very importantly you should remember, is that glucocorticoid therapy should be gradually decreased before stopping it completely. So you are going to, whenever the patients who are given glucocorticoid therapy, it should be slowly and gradually it should be decreased. Gradually it should be decreased before stopping the therapy completely. Why? Because sudden cessation of the glucocorticoids drugs, sudden cessation of the drug may cause suppression of the hypothalamo pituitary adrenal axis. So very important, the suppression of the hypothalamic pituitary adrenal axis, which can lead to the following manifestation. So students and viewers, very important, sudden cessation of the glucocorticoids should not be done. If the drug is to be stopped, it should be the dosage of the drugs should be decreased gradually, means the dosage needs to be tapered, and slowly and gradually it should be stopped. It should not be stopped suddenly. Alright, so the following manifestations can be seen by the suppression of the hypothalamo pituitary adrenal axis. The first important point is that if the patient is on long-term glucocorticoid therapy and sudden cessation of the glucocorticoids has been there, so ultimately the patient who was being treated for that particular condition, that condition may precipitate, or the flaring up of the underlying disease may take place. So the flaring of, or the precipitation of the underlying disease being treated, and it can be seen. Apart from this, there can occur reactivation of the disease. So students and viewers, very importantly, so if glucocorticoids drugs are stopped abruptly or suddenly, very important, there can occur precipitation or the flaring up of the disease, or even in some cases it is seen that there can occur reactivation of the disease as well. Now moving on to the next important point is that there can occur withdrawal symptoms in such patients, such as these patients may experience fever, myalgia, that is muscle pain, they can experience arthralgia, that is joint pain, they can have. Apart from this, they can have the feeling of malaise, etc. So these are the withdrawal symptoms what are associated to abrupt cessation of glucocorticoids. The third point what needs to be considered is that just because the hypothalamo pituitary adrenal axis is being suppressed, or the suppression of the adrenal glands has also been taken place. So very importantly, if such patients who are on long-term corticosteroid therapy, when they are subjected to stress, the patients can go into acute adrenal insufficiency. So acute adrenal insufficiency can take place in such patients, and which may manifest in the form of anorexia, that is loss of appetite can occur in such patients. Apart from this, there can occur nausea, there can occur vomiting, there can occur abdominal pain, there can occur hypotension, dehydration of the patients can be seen, there can occur hyponatremia. So the lowering of the sodium content in the serum, that is hyponatremia, Apart from this, there can occur hyperkalemia. So the potassium level rises. So in such, these are the symptoms what can be seen. So very important, due to suppression of the adrenal axis. So adrenal insufficiency can occur, and adrenal insufficiency can manifest in the following forms. Now moving on to the next point, that fourth very important point is that any patient who has received more than 20 to 25 milligram per day of hydrocortisone, so such patients should be put on a scheme of gradual withdrawal. Very important. The dose is to be withdrawn gradually, not suddenly. Very important. Apart from this, such patients who are given hydrocortisone in the dosage of 20 to 25 milligram per day, such patients, if abrupt withdrawal is there, such patients may need protection. These patients may also need protection with steroids if they encounter a stressful situation during the coming period of 1 year after withdrawal. So student, these are the reasons why abrupt or sudden cessation of glucocorticoids should not be there, should never be done. The dosage needs to be tapered. The doctors mostly taper down the steroids slowly and gradually. They taper down because ultimately this can have very many adverse effects in the patient. So very many side effects can be seen if these glucocorticoids, they are abruptly stopped. So students and viewers, if you like this video, give this video a thumbs up. Those students who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.